When did you actually become commissioner?
Coronavirus.
Lead poisoning.
West Nile virus.
Public health is the greatest story never told.
His title, Cuyahoga County Health Commissioner. But a retiring Terry Allen could add Captain of Crisis to his bio.
Yeah, it's been quite a run here the last few years.
To understand his influence and experience, you only need look back at what he's faced. I first met Allen in 2001 during a Legionella outbreak at Ford's Brook Park plant.
The unions supported us in the process. The plant was shut down for a while.
Long enough for the plant to be thoroughly cleaned and for lessons to be learned.
Ford developed a national water management plan that is being used by auto industry all around the world as a result of that process. So something good came out of it in terms of prevention of exposure.
After 9/11, fears of anthrax and smallpox bioweapons. From this, a pandemic playbook and a blueprint for mass vaccination clinics. Public health got a seat at the command center.
There was a cascade that really started with public health planning around the country. We were not involved in incident command response in emergencies in that way prior.
In 2002, it was West Nile and then SARS. By 2004, Allen took over as health commissioner, where he'd usher in Ohio's indoor smoking ban, face a norovirus outbreak, and swine flu epidemic, where the mass vaccination plan went into use for the first time.
Ebola.
A big outbreak of the deadly Ebola virus.
Then in 2014, a nurse working in a Dallas hospital was exposed to Ebola. She flew home to Akron and set off panic in Northeast Ohio.
I mean, we went many days with sleepless nights, but we fortunately did not see transmission. We were very busy at identifying and potential people on planes that might have been exposed. And we were busy trying to calm fears.
And then 2020.
Tonight, U.S. cases of coronavirus.
Over 800,000 COVID-related deaths.
So we were flying blind early on.
In the 2 decades I've known him, Terry Allen and I spoke often about the next pandemic, though neither of us thought we'd see it in our careers. We were wrong.
We had to just follow what we thought were the best recommendations on what was available. We tried to provide guidance to our long-term care facilities to try to reduce exposures to our most vulnerable.
When the pandemic started, when was the first day you had a break?
It was at least a year. I worked, I think, straight every day for a year, but so did you, and so did lots of other people.
The numbers don't lie. In 2 years, his team fielded 60,000 phone calls, held more than 100 briefings.
Now over 4,000 people that have died. We've had over 3 times as many people have been quarantined, have been isolated. So we're talking on the order of 500,000–600,000 people that have been impacted just by people we know that were tested positive.
Some decisions, especially those relating to schools and masks, drew heavy criticism. Allen followed the science and says it worked.
And sometimes we have to make difficult decisions and recommendations. But we're doing it to keep people out of the hospital. And we do it to save lives.
What will haunt you?
The 4,000 people that have died, the early deaths happening in the nursing homes when we were still trying to understand what was happening.
The accomplishments that make him proud, somewhat surprising, like cutting the number of septic systems in the county by more than half.
Which has reduced a lot of illicit discharges. Or communities have replaced septic systems to reduce illicit discharges, cross connections with sewage going into creeks and into the lake. You know, that's pretty cool.
Reducing the rate of childhood lead poisoning by 76% and the 28% drop in heart attacks post-indoor smoking ban also brings satisfaction. But when Allen officially retires Thursday, he'll take the accomplishments and memories, but something else too.
I think most of all, for me, you know, it's been an honor to serve with the staff, this staff, particularly over the last 2 years.
Allen is also proud of the department becoming nationally accredited by the National Public Health Accreditation Board. Allen's successor is Dr. Rod Harris, a Cleveland native who left his job as deputy director for the Allegheny County Health Department in Pittsburgh. I asked Allen what advice he would give the new commissioner. He said he'd tell him to take it easy on the staff. They're tired, and he needs to listen to their stories, both personally and professionally. In the newsroom, Monica Robbins, 3 News.